This is a Compass to MS Care event reaching rural America and underserved communities. And my name is Stuart Schlossman. I want to thank everybody for being here. Tonight's program is sponsored by Genentech, and we want to thank Genentech for what they are doing. And of course, tonight's program, we do have Megan Weigel, and she'll be speaking about what you can read in front of you. Megan, thank you for being here. Thank you for all that you do. And for everybody that doesn't know, Megan is really a godsend to the industry for what she's able to provide, not just for our programs, for all the stuff that, all the programs that she's on with other companies and what she does for her local community. So Megan, thank you. And Megan's going to speak for 30 minutes, 35 minutes rather, and then we're going to do about 30 minutes of Q&A. Take it away, Megan. I'll be back in 35 minutes.
All right, guys. Well, thank you for being here. I see there's about 24 of you. I am so sorry that we couldn't be here in person, but truth be told, I was getting a little bit nervous about this being, it would have been my first program in however many years, right? So I was thinking, gosh, there will be a lot of hugs and, you know, probably some tears. It's been a long time. And in any case, I think given what's happening with Omicron right now, it was the best decision. And I'm just sorry that that Stuart was a recipient of the fraternity party, as I say, with the Greek alphabet and COVID. It's just a little joke that keeps me sane. So tonight we're going to talk about my favorite topic. As many of you know who have heard me speak about this on MS Views before, integrative medicine and MS. Why should I care and what should I do? So a little bit of a different spin on this. There we go. We'll talk about the difference between integrative medicine and complementary and alternative medicine and other holistic paradigms, because the marketplace, the healthcare city, the social media, the wellness industrial complex, as we like to call it, is just filled with different ways to take care of yourself. My specific training is in integrative medicine. I really believe in it. And so I'm going to address care and MS with integrative medicine strategies. And I'm going to give you some practical things to do that employ integrative medicine. Well, integrative medicine is a broad definition of health. It covers a wide range of interventions. Sometimes I feel like I can do so much and offer so much that it's difficult for me to hone in and make things a little bit simpler for you, a person who may be out on the internet, Dr. Googling things and coming up with 50 supplements to manage one thing and trying to take them all and wondering why I might say no. So there's lots of different modalities that integrative medicine includes in its recommendations, but it's patient-centered care, which means it's driven by your belief system. It's driven by your needs and your goals. It involves coordination of care, and as I said, a variety of modalities. My favorite definitions are these because they involve the word healing. Integrative medicine is healing oriented. It focuses on the least invasive, I just found a typo. Oh my goodness. The least invasive, the least toxic, and the least costly methods to help facilitate health. I think that integrative medicine and holistic medicine services are not inexpensive because they are often not covered by insurance. And that's one of the major problems with integrative medicine, complementary and alternative medicine, any form of holistic therapy, except for acupuncture sometimes and chiropractic, but that is a challenge. In any case, the recommendations are made based on understanding physical, emotional, psychological, and spiritual aspects of you, and it maintains that healing is always possible, even when curing is not. And what that means, I think, is right now we don't have a cure for MS. Our disease-modifying therapies are really, compared to what we had when I started 22 years ago, are much more effective. And we're also diagnosing MS much quicker. So the trajectory of MS looks a lot different for a person who's newly diagnosed today than it did for someone 40 years ago. It doesn't matter. Either one of those people, doesn't matter the severity of their MS, has an experience when they're given a diagnosis of a chronic neurological condition. And one person may take that experience and make it positive. I have many patients who say MS is the best thing that has ever happened to me. It caused me to change my attitude. It caused me to change my diet. My life is happier. Those people have healed, even though their MS is not cured. So that's what I love about integrative medicine, is how can I help a person find that healing space, even if they still deal with challenges on a daily basis. Complementary and alternative medicine is not integrative medicine. It's a non-mainstream practice that's used with conventional medicine. Alternative medicine is a non-mainstream practice that's used instead of conventional medicine. And I'm going to give you some more definitions in a bit. These are types of complementary and alternative medicine. They have done another survey since 2012, but in my opinion, it was pretty crappy. And basically, it only said that people use yoga now. It didn't address any of these other CAM therapies. So in 2012, the most common therapies were using natural products like supplements other than vitamins and minerals, so botanicals and herbs, doing deep breathing, doing various forms of mindful movement like yoga, Tai Chi, and Qigong, chiropractic and osteopathic care, meditation, massage, special diets, homeopathy, progressive relaxation, and guided imagery. Prior to this, the most common type of CAM therapy was actually prayer. Prayer's not even on this list anymore, which I think is kind of sad. In general, per this survey, about a third of U.S. adults used CAM, about 11% of kids. More than half of the respondents had pain 3 months prior to the survey. And you can see in 2012 what the out-of-pocket cost was that people spent on CAM. In MS, 30 to 80% of people living with MS use some form of complementary and alternative therapy, more likely to be women of higher levels of education and report poorer health. Most of these people are also seeing conventional medical doctors. Many of these people may not disclose what they're doing to their clinicians because they don't think it's important, or they don't think that there's the possibility for harm or an interaction with the disease or a drug. And I would argue that given that most natural products include vitamins and supplements, and this is one of the most common types of CAM used, it's very important to disclose what you're taking on a daily basis. Also, what you might be getting an IV bar once a month. Because some of these herbs and vitamins can theoretically worsen MS, or even compete with your disease-modifying therapies, or even harm your liver or your kidneys in addition to the medications that you're taking. So it's really important to disclose what you're taking to your healthcare providers. This is a little algorithm that I like to use to help people decide whether or not they want to try something. So the first question I ask is there evidence that this is helpful for an MS symptom? And if there's some evidence, then we can go to question 3. Then go to the next question. Does the evidence outweigh any risks, with the risks being financial harm? So let's say that you want to get a magnesium infusion. Is there evidence that this might help? Well, magnesium can help headaches. It can help muscle spasm and pain. It can help anxiety, constipation, sleep, all things that can be problems for people living with MS. If you don't have diarrhea, it's probably not harmful. And if you don't have a cardiac arrhythmia, it's probably not harmful, but is it expensive? So if someone's charging you $250 for a magnesium infusion, I would say, heck no, it's not worth it. But if it's $50, it might be worth a try. So that's kind of that. If there's no evidence and you want to try it anyway, is it harmful or costly? Well, if it's harmful, don't take it. Let's look for something else. If it's costly, don't take it. Let's look for something else. And do you have realistic expectations of what you might take? So if you take bee propolis because you think it's going to cure your MS, then your expectations are unrealistic. You probably shouldn't put your eggs in that basket. So that's how I use this algorithm. And I will always provide a directive for something for which there's no evidence, it may be harmful, or maybe there's something cheaper that a person can use. So here's this chart that I love. One could think of it as, we're going from one end of the spectrum of the other, but I would put integrative medicine closer to conventional medicine and put alternative and complementary medicine. I'd kind of switch places here. Conventional medicine is disease focused. It treats symptoms using drugs, radiation, or surgery. It serves as the knowledge base for Western medicine. It's what we go to the doctor for. You have diabetes, here's your metformin. You have high cholesterol, here's your Lipitor. You have cancer, let's cut it out. You have MS, here's your disease-modifying therapy, your drugs to manage your symptoms, and here's steroids if you have a relapse. I will say conventional medicine is getting a little bit better with recommending the approaches we'll talk about today. Alternative medicine is used in place of conventional medicine. So it's seeing a naturopath who are wonderful vessels of knowledge and have so much to bring to the table, but seeing a naturopath taking supplements and not taking disease-modifying therapy that's recommended for you. Complementary medicine uses a combination of the alternative therapies with conventional medicine. Integrative medicine, which is what I practice, also does that, but in a way that is favorable for both sides of the coin. So someone practicing alternative medicine might tell you that they don't want you to take a disease-modifying therapy, but you do anyway. Someone practicing conventional medicine might say all supplements aren't safe for you. I doubt that would happen, but it's kind of one way or the other. Whereas in integrative medicine, I can say, you've been working really hard on trying to get your cholesterol down for 2 years with diet, exercise, omega-3 fatty acids, and bergamot. It has not budged. I think it's time to try a little bit of a prescription and continue your healthy diet changes. Or I believe in the power of disease-modifying therapies for multiple sclerosis, but I also know how important it is to modify your diet, move your body, stress less, and hey, let's talk about how your soul is doing. So that's integrative medicine. Functional medicine, I think, is the biggest flood of social media today and the biggest driver of what I would call biohacking. So patients going online to try to figure out what's wrong with them and coming to the doctor asking for tests that haven't been validated, except they've maybe been tested in animals. It really questions the foundation of conventional medicine, and it's based on biochemistry, systems biology, the things that naturopaths study. But unfortunately, the study of functional medicine doesn't take as long as a naturopath went to school for just as long as a medical doctor or a doctor of osteopathy ended a recidency. Whereas a physician or a chiropractor or a dentist or a health coach can go take courses in functional medicine and claim to know as much as those other people. And in my opinion, it's conventional medicine's way of taking something that has a very long history and putting it into an algorithm that substitutes supplements for medications. So for a lot of people, it does get to the root cause of the disease, but for many people, it doesn't, and they're spending thousands and thousands and thousands of dollars, which is why, and this is just my belief, I dip a pinky toe in functional medicine. It's the third level of where do I go when a person needs additional support or help. My focus and my training in integrative medicine is more in ancient forms of medicine like Ayurveda and traditional Chinese medicine. So why should you care about any of this? All right, you guys know all this. Over 1 million people in the US have MS. More men than women have it. It's more prevalent in Caucasians. It's more severe in African Americans and males. There is an association between increased MS risk and worse MS with smoking, also with low vitamin D and obesity, also with having had clinical mononucleosis, not just testing positive for Epstein-Barr. I would encourage all of you to read a bulletin put out by the National Multiple Sclerosis Society that deals with very hot off the press pivotal research that proves the relationship between Epstein-Barr and MS hands down once and for all, and that also proves that having clinical mononucleosis is associated with an increased risk of MS. It came out today. The other reason we're talking about integrative medicine is because the most common comorbidities in MS are things that integrative medicine does a really good job treating: depression, anxiety, high blood pressure, high cholesterol, chronic lung disease. The most common autoimmunities that occur with MS are thyroid disease and psoriasis. Integrative medicine does a really good job at treating autoimmune and inflammatory conditions. The following conditions occur more commonly than previously thought: stroke, heart disease, CHF, inflammatory bowel disease, arthritis, seizures, all these things here. Why are we talking about them? Well, most of them harm your nervous system, which makes your reserve lower. Integrative medicine will not just help one thing like many medications do. It helps your whole body work together as a better machine. Your body has an innate capacity to heal itself, and integrative medicine helps your body find that path. So an example of this is feeding your body healthy food helps your blood sugar, your heart, your brain, your mood. Comorbidities worsen MS. So a vascular comorbidity occurring at any time in the disease results in a progression of EDSS of 6 by approximately 6 years sooner. That means hypertension, diabetes, overweight, obesity, hypercholesterolemia, peripheral arterial disease, heart disease, cerebrovascular disease. Shorter telomere length is associated with progressive MS. All of these conditions I just said shorten telomeres. Telomeres are like the example of aging on your DNA. You can actually have them measured. It's not an FDA-approved test, but they are being studied in MS. They're your marker of biological aging. Because there's more data for using integrative medicine than in MS, we can talk about it with comorbidities. And this provides us with an opportunity to give you education. So what else? What else about these comorbidities? Well, when you have these comorbidities, you lose neuroplasticity. So neuroplasticity is this general term that refers to the brain's ability to modify, change, and adapt. It's influenced by your body's internal environment and your external environment. So internal environment, how healthy your body is. External environment, what are you letting into your mind and your heart? What's causing you stress? Mental challenges, exercise, nutrition, TLC, social interaction, sleep, meditation. So what do we have to say about brain health? Brain health typically refers to things you can do to decrease your risk of dementia. But we're going to talk about it in terms of MS. This movement was initiated because of the association between hypertension, diabetes, and obesity and dementia. All of these things also increase the risk of disability in MS. So in MS, improving your brain health not only improves your overall health, but may have the potential to improve MS progression as well as symptoms. So how do we measure brain health in MS? Well, we look at MRIs. We look for white spots. Do you have more scars? We look for enhancing lesions. Do you have active disease? We look for T1 hypodensities or black holes, which signify axonal transection or loss. We look for brain atrophy. We look for spinal cord atrophy. We also do a history and physical. Do you have other medical conditions that are threatening your brain? Are you having symptom worsening, new symptoms, relapses? Do you have exam changes in any one of the areas that can be affected in MS, like vision, sensation, motor, movement, coordination, balance, cognition, pain, speech and swallowing, bowel and bladder issues? What else affects brain health in MS? Smoking, dehydration, nutrient-poor diets, lack of exercise, stress, poor sleep, and infections. Why? These states directly or indirectly increase stress in your body, and it disrupts homeostasis. It disrupts that inner calm, can cause fight or flight responses that don't go away. This sympathetic nervous system, chronic activation of the sympathetic nervous system or your fight or flight response causes immune dysregulation, inflammation, and what is primed to go awry will. Hopefully you guys have seen this. It's really old now. It is 6 years old and actually probably 8 years old from the time we first started sharing it among ourselves as MS people. This is your MS pool. These little mountains are lesions, and your pool, if it were full, we wouldn't see these lesions show up. But as your reserve or the water in your pool starts to go down, starts to drain, then things that you didn't know were there before start to show up. And this is where we see progressive MS. So I'm not talking about new enhancing lesions here. I'm just talking about these plaques have been around forever. You didn't know they were there. But man, as you became sicker with time, with other medical conditions, as you became more sedentary, as you became more depressed or anxious, you might have started to notice that your body didn't work as well. You weren't thinking as well. Maybe your mobility declined. Maybe you were having more pain, more sensory changes, more issues with balance. So the point here is we want to do things to keep our pool filled up. So let's talk about what you can do with your mind, your thinking. You know, I like to tell people to set themselves up for success. So when you make a to-do list, make it manageable. Have support contacts available in case you need them for specific things. Like maybe you have a friend that helps you with maintenance in your home. Maybe you have a friend that drives you to doctor's appointments when your fatigue is bad or when you're not feeling well. Maybe you have someone to call on to do grocery shopping. All of these things, just having them set up can provide you with a better sense of calm. Limit news watching. Limit news reading and social media time. And if you're compelled to watch or read these things, don't do it before bed. I cannot tell you how many people I see on a daily basis who tell me that their greatest source of stress is the news. And I write them prescriptions for no more than 10 minutes twice a day of watching or reading the news. Now, it's important that we all know what's going on right now, especially regarding how we keep ourselves safe. But going overboard with it can really send you into a tailspin. The other thing that's important for your mind is to deal head on with your MS and other health conditions. Don't be like, oh, I'll take care of that in 3 months. I don't feel good, but I have an appointment 6 months from now, so I'll just talk to my doctor about it then. I had that happen to me today with a patient. And then schedule time to work on your body and your spirit. Here are things you can do for stress management. Depression and anxiety are common in MS, clinical depression and anxiety that require treatment. If you aren't asked at a provider's office and you feel depressed or anxious, please share your concerns. Ways to manage stress. Well, is it disrupting your life? Talk to your healthcare provider. That person might give you medication and hopefully also a referral for talk therapy. Doing things like meditation, mindfulness exercises, breathing exercises can be helpful for stress management. Exercising, getting outside, decreasing caffeine, which can increase your heart rate and make you feel anxious. Decreasing alcohol use, which can make you dehydrated, increase your heart rate, and make you feel anxious as well as depressed. Decreasing sugars and processed foods in the diet, increasing omega-3s and plant foods in the diet, and learning to say no can all be really helpful. Making sure you're managing your MS by keeping regular checkups is so important. Having MRIs recommended annually, talking about new symptoms or disability changes with your providers, talking about your disease-modifying therapy and whether it's working for your life and for your MS is important. Are your symptom management medications working for you? Do you need a rehab tune-up? Do you need a little revisit to PT, OT, or speech? Do you need any referrals to see specialists? Are your other medical conditions under control? If you have diabetes, how's your hemoglobin A1C? If you have a history of cancer, are you keeping up with regular checkups? So for your body, we want to nourish it, move it, and rest it. I don't, with these talks in this short amount of time, I don't talk a lot about diet in great detail. I talks on MS Views regarding diet, also to Can Do MS. There are some wonderful talks on very specific diet changes. But please don't think that you have to follow a diet to nourish your body healthfully with MS. My rules are eat food, not too much, mostly plants. The right diet for you is the one you're going to follow. Because if I told you to become a vegan and you liked red meat, you probably wouldn't do it. But we can teach you how to eat red meat in moderation within a plant-based diet and do it a little bit more healthfully. Drink plenty of water every day. And then take a look at your daily intake. What can you take out? Could you take out just soda? Like if you drink 6 sodas a day, could you just reduce it to 3 and then maybe try to work it out after that? Could you take out alcohol? Could you take out sweet tea? I met with a woman last week who drank 64 ounces of sweet tea a day. She has a history of breast cancer. If she lost weight and went from an obese category to a normal weight category, she would reduce her risk of death by 70%. 64 ounces of sweet tea a day. So we came up with a plan to help her wean off of that. Could you take out processed snacks and desserts? And so you take out one thing, and then what could you put in? Could you put in a handful of green leafy vegetables with each meal, or even vegetables with each meal? Could you put in a handful of chia or flaxseed in your oatmeal? Could you start eating nuts for a snack instead of chips? Those sorts of things. So moving your body, first most important thing, what do you enjoy? So goal exercise is moving your body for 150 minutes a week. That means 21.4 minutes a day. You want to move at your best time of day. You want to use cooling equipment and drink cool fluids, even if you're in your house in 68 degrees of air conditioning. When you move your body, even with stretching, even with gentle yoga, even with doing things, say 5 minutes at a time, picking up some of Dr. Gretchen's exercises for 5 minutes, your body still heats up and uses energy. Putting a neck wrap on, taking a sip of cool fluid, water before you do the exercise and after you do the exercise is going to help your nervous system conduct better and help you conserve energy. Splitting up exercise if you need to, 10 minutes now, 10 minutes later, same benefit. And then involving your friends and family because it's more fun and it also helps encourage each other. Resting your body. So avoid using electronics for at least an hour before bed. And if you're the type of person who likes to read on a Kindle or on your iPad, use a blue light filter. You can get ones that cover the screen, or blue light blocking glasses. You can get them on Amazon for $10. Avoid caffeine, excess alcohol, and sugar before bed. I like how I wrote void caffeine. It's obviously a typo, but voiding it means getting rid of it. So I guess it's okay. And then creating a calming bedtime ritual can also help, like writing down 3 things you are grateful for today, or journaling, doing some gentle stretches. One of my favorite before bed is legs up the wall. So you would lay on a floor or your bed and just elevate your feet up against the wall. If you need help with elevating your legs, you could have a support partner hold them up for you and just provide you with support for a couple of minutes. Using essential oil in a diffuser, the one I like best for bedtime is lavender. Ylang-ylang can also be calming. Chamomile can also be calming. And maybe drinking a decaf herbal tea with the caveat that you don't want to get up at night to pee all the time. So rounding back in our base running on taking care of the mind, body, and the spirit as really the crux of the integrative part of integrative medicine, some things that you can do to nourish your spirit. And by spirit, I mean your heart, not your literal heart, but your figurative heart. I mean your soul, like the things about you that are connected to something bigger, the places where your dreams come from, where your love comes from. We really want to nourish those because that is really where healing comes from. So starting your day with a positive affirmation, making time for mindfulness or meditation. I spoke about that earlier with stress management. My favorite apps are listed here. Exercising your creativity with color, paint, arranging flowers, gardening, playing with your kids. I even just watching your kids or grandkids play is sparking creativity. Remembering to breathe. So I do something called Monday Mantras with Megan. And I'll talk about that in a little bit because I have a discount code for Stu. But with those Monday Mantras with Megan, also with Can Do MS, there's a Mindful Monday podcast. And they go along with each other. The podcast is free. This week's mantra is, I find calm with my breath. And I encourage you to think about whether or not you're actually even breathing right now. And if you are, how deep is your breath going? Because your breath is probably just staying like right here, not even going into your throat. So remembering to take full, deep breaths through your nose, down your throat, into your chest. Chest can expand in all these directions, from front to back, from side to side, diagonally, just remembering to breathe. Connecting with loved ones. And then one of the things that integrative medicine offers is energy healing. And this might be with certain types of massage, with Reiki, with acupressure, even acupuncture can offer energetic healing. A technique called neuroemotional technique, frequency-specific microcurrent, one brain. There are all kinds of methods of energy healing that can help nourish your spirit and help you realize as your own healer what you need to deal with to move on with your life in a more positive way. So treating the spirit is my favorite part of my practice. And my teacher this weekend at a course I took said, when you treat the spirit, you treat the whole being. And my why is for integrative medicine is that, in my opinion, integrative medicine is the practice that truly merges treating the spirit with the body and gets the best results. So I told you why. and I told you how. And now I'm going to turn it over to Stu for questions.
Hey, everybody. I had to make it look like I'm, back in the field again, looking everywhere, okay? But I want to thank Megan for all of her talk. And I want to ask her I was just looking up the Monday mantra code, and I was going to give that out to everybody, but I'll do that in a few minutes, all right? Or I'll let them all know about it afterwards, or you could say it now, and I'll just type it in on the screen.
So MondayMantrasWithMegan.com. And the annual subscription, this code gets you half off. I think it makes it $11.99. And with the code MSVN for MS Views and News, MSVN22, you get half off. And I donate half of that back to MS Views and News to support programs like this.
Great, thank you. And so I just sent out the code to everybody, and so they could have that code, but I forgot to put the website address, so we should actually do that again, and then everything would be good. Monday Mantras, mantra with Megan. And what is your URL again?
.com, MondayMantrasWithMegan.com.
Makes sense, right?
Makes sense, yeah.
Monday Mantra with Megan, all spelled out, huh?
Yep, Monday Mantras with Megan, mantras with an S. MondayMantrasWithMegan.com.
Okay.
I can share my screen again and take
you could, but all right. Sorry about that, everybody. I'm just trying to get this typed without my brain going wacky and wanting to type something else. 50% off. Okay, great. All right, so I'm sending it out to everybody, and then we will get started with the questions. All right. So first, thank you very much again. And a person writes, having seen adverse effects, specifically balance problems from alpha-lipoic acid. Have you seen adverse effects, specifically balance problems from alpha-lipoic acid?
Lipoic acid. Yeah, so that's a good question. Alpha-lipoic acid has been studied in MS, and there's fairly good evidence to support that it is associated with slower progression and secondary progressive MS with mobility. So one of the things that can happen if your mobility starts to improve is that because you're walking differently, you can lose your balance. Like you're walking too fast, more than your brain is used to. Now, if that's not the type of balance loss you're talking about, I have not seen that with alpha-lipoic acid. However, because we are now studying alpha-lipoic acid in a more rigorous way, we are finding that it rarely can cause a nephrotic syndrome, which is a kidney syndrome, but it could potentially cause harm. So this is just something I think that's important to share, because we willy-nilly recommend alpha-lipoic acid like we do with a bunch of other things, thinking, well, there's no way this could hurt people. And then once we start studying it in larger groups of people for longer periods of time, we find out that there are side effects. Even with high-dose vitamin D, even with low-dose vitamin D, if a person has kidney or liver dysfunction, it can make that worse. So I think that's a really good question, and it brings up a good point about supplements that many people will just say, well, that's got to be safe.
Great, thank you for that.
Sure.
There are people that came on late and wanted to know why there's a different backdrop and a different steward than normal. And I just have to tell them again, I won't go into the whole thing again. They can watch that when they, if they want to watch it from the beginning, when we put it onto our YouTube channel. But everybody needs to know that, yes, I became COVID positive, and very fortunately, I am vaccinated. I'm not going to go on my rave and rant tantrum that I did earlier, okay? But fortunately, I've been vaccinated and boosted, and this is just like a mild cold. It's I'm very fortunate. And to just have a very slight fever, if any, at this point in time. And it's only 2 days ago that I tested positive, so I'm doing great. Okay?
Yay.
All right. Yes, thank you. All right, so other questions that came up. Well, Krista's asking about the slides being available. And Krista, I'll answer that, and that's that yes, this program will go onto our YouTube channel in a few days. All right. And you'll be able to watch it again from there and catch all of Megan's slides at that time. And the way that you get to copy them or take pictures of them is to just stop the video from rolling, and you could stop and take your phone out and take a snapshot or do a screenshot of it, and you'll be good to go. Okay. All right.
Please just don't associate me with the slides that have spelling errors.
Oh, sure. I can't fix them though, so we can't do that.
I'm so embarrassed.
But it's okay. It's okay. We all do it, and we all catch it when you're going to show it to somebody, right? Right. So Krista, it'll be about a week, and then it'll be on our YouTube channel, which is youtube.com/MS Views and News. And you could always write back to me in 2 weeks and say, hey, I haven't seen the video on there yet. And I'll say, it's there, but you have to go to what I just told you as the URL. Okay. All right. So next, we have Brenda. Brenda's, I've recently read about possible benefits from MCT oil. Are you familiar with MCT oil?
Yeah, so MCT oil is medium chain triglyceride oil. The most commonly one that's used, ingested, put in things is coconut oil. It is huge in the keto world. Benefits of it do include benefits that we see with good fats, also with metabolism. However, using too much, because depending on what you're using, the MCT oil can be high in saturated fat, can actually cause adverse changes in your lipid profile. So I don't recommend taking, 2 tablespoons of MCT oil 3 times a day. Sometimes people will put a serving in a smoothie or in their coffee. I don't believe in doing any of I shouldn't say any. I don't believe in doing many of these things on a daily basis. So let's just think about this. If all you did was, and you're eating healthy, if all you did was eat baked chicken and broccoli every night for dinner, you ate the same thing for breakfast, let's say maybe you had some kind of protein bar, and for lunch you had a salad every single day for a year, guess what would happen? You would become nutrient deficient.
I thought you were going to say they look like a salad.
Yeah, well, you'd probably lose weight, but you'd also be nutrient deficient because you didn't vary what you were eating. So similarly, if you're deciding that MCT oil is going to cure all your ills and you're going to use it 3 times a day, chances are you're not going to get the benefit from it. So use it sparingly. It's my advice.
Great. Thank you for that. So you mentioned coconut oil before, and somebody actually told me I should be drinking coconut something. I don't remember what, coconut water. That'll help me build up my immune system that way as well. And I didn't know, so that's why I'm asking you about that.
No, coconut water has a nice balance of electrolytes. And so people drink it as an electrolyte replacement, as a fluid replacement after exercise instead of something like Gatorade. It's probably a healthier form of that if it's natural and not artificially flavored with other things.
Okay.
But it's not going to boost your immune system.
Okay, thank you for that. So that being said, what will boost the immune system that is safe for an MS patient to be taking?
Well, that's
and
a great,
when?
Yeah, so that's a great question. So people living with MS, many people living with MS have this misperception that their immune system is low. That's the term I hear. My immune system is low. And I'm not speaking about disease-modifying therapies, just I have MS, so my immune system is low. So I want to take something that boosts my immune system. Well, your immune system actually works quite well. It just works wrong. So it's like the, I don't know, like, what's a good analogy?
It's hyperactive.
Yeah. Well, it's not hyperactive. It just works wrong. So it's like having a fast car, and instead of driving it on the highway, you keep driving it into a brick wall as fast as you can. Like, you have what you need, but your body's doing the wrong thing with it. So when you give it things to boost it, it makes the wrong thing worse. So the best thing you can do to support your immune system to work right in MS is to do things without a sledgehammer. Like, don't take a bunch of supplements that claim to boost your immune system and then still drink a 6-pack of soda a day and eat wings for dinner. Change your diet. Start eating more nutritiously. Stop drinking so much alcohol. Stop watching the news and getting pissed off. So all of these things can cause smoldering inflammatory problems in the body that worsen your MS. From a supplement standpoint, vitamin D, making sure your vitamin D level is around 50, getting advice from your healthcare provider about how much vitamin D to take to do that. What we want to do is balance your immune system. If you're on a disease-modifying therapy, depending on which one you take, your immune system may be suppressed. And I can't help but wonder, in those situations, your immune system is suppressed. It's also learning how to work a little bit better. Could some of these supplements be safer? We don't know, because nobody's going to pay for that study. But right now with COVID, the safest thing to do is to wear a mask when you're out and about, to get vaccinated, to keep washing your hands, because you can get Omicron from, or COVID from the gas pump, and then wiping the dirt out of your eye or picking your nose on the way home from the gas station. Sorry, it's getting late and I'm hungry. So those things. And then if you're exposed, depending on your other medications, it may be safe for a short period of time for you to take increased doses of vitamin D, vitamin C, zinc, omega-3s, and acetylcysteine. We still want you to stay away from echinacea. There's no place for that in MS. And for those things that I recommended, I would review them with your healthcare provider because of the potential for other drug interactions.
Okay, thank you for that. And by the way, I always wear my mask, as I was saying before, when I'm out and about. And I'm always using hot water, washing my hands as soon as I come home. And when I go to a gas pump, as soon as I finish putting it in, and whatever this goes into my hands, it goes in when I first put the pump in, when I take the pump out, it's always being done. And I am so safe all the time. And like I said earlier, I'd like to know where I got this from, because I think it was somebody that just isn't as careful as some of us are. Okay. And they walk around and they really don't care about anything else. All right. So anyway, thank you for your answer. And I'm done ranting about that. But, it really sucks when you get sick like this and you're stuck in a 10 by 10 room,
Mm-hmm.
All right. Anyway.
I loved it when I had to quarantine alone.
Yeah, well, you got to stay away from your family, so that was cool, right? All right. Next question is from Kay. Kay is saying, my MS neurologist suggested intermittent fasting for inflammation. How does this help?
So that's a great suggestion. So for people who don't really want to change the way they eat, or they have, but they're still experiencing some issues, or they haven't enjoyed any weight loss from significant diet changes. Diet changes aren't about weight loss, but if you go from eating a really crappy diet to eating a really healthy one, you're going to have some benefit in weight loss. So what intermittent fasting does, and the sweet spot is about 13 hours, is it stresses out your mitochondria just enough. Your mitochondria are the powerhouses of your cell. You can think of them like your hot water heater, your thermostat. But your thermostat, your furnace, your hot water heater, powerhouses of your cell. It stresses them out just enough that they're like, oh, wait, we got to work a little bit harder. We got to make some more energy here. We got to figure out how to be more efficient at our jobs. And what that translates to is a better working body. It also translates to getting rid of cells that the body doesn't need. So it's kind of like it can be a cellular reset. And it is being just now starting to be studied in MS as far as what changes might we see from people who intermittent fast.
Okay, thank you.
I'm a advocate for the longevity diet and fasting mimicking diet. Prolon, Prolon, is the program. You do these 5-day courses every 3 months of low calorie diet, and it does mimic fasting in the body, and it creates cellular reset. It's been studied in MS and animal and human models, and it's quite interesting. So,
okay, thank you. Rhonda wants to know, well, Rhonda says, I noticed with the cooler weather, my balance is affected. Is this normal?
So most people who live with MS have trouble in the heat, but many people have trouble in the cold too. So I wouldn't say it's normal, but it might be normal for you. And if you're experiencing balance challenges as a new symptom, I would go ahead and call your healthcare provider, get in to see them, and see if maybe a physical therapy referral wouldn't be good for you.
Okay, thank you. We have about 1, 2, 3, 4, 5, 6, 7, 8 questions remaining. Okay. Okay, great. Magnesium, should an insomniac take it in the AM or the PM or both?
I would take it in the PM.
Okay. Does that actually really work to help somebody get to sleep?
I mean, taking it in the morning isn't going to make you sleepy, but there might be some placebo effect to taking it in the evening.
Okay. What about melatonin? How's that actually work out?
So melatonin works for some people. I recommend starting with low doses, 1 to 3 milligrams. Most people take 10 milligrams off the shelf. That's too high. The most common side effect is nightmares. So 1 to 3 milligrams an hour before bed. You got to try it for a couple of weeks to see if it works. It's worth a shot.
Okay, thank you. Next one. Person says, I've always eaten a Mediterranean diet because I also have type 1 diabetes. I've recently heard there may be better diets for MS. Is this true?
No. So I'll go back to that slide that says the best diet for MS is the one that you're going to follow. So if you're struggling with your diet, a Mediterranean type diet, and you think you want to make some more aggressive changes, you might consider being gluten-free. You might consider working with a nutritionist to fine-tune that Mediterranean diet. See if that could help. Yeah.
All right. I didn't know if you were trying to pull up a slide. So.
No, I got a little weird pop-up down here, and I just wanted to make sure that my thing was working right for you.
Gotcha. Okay, so next one is my nutrition affects my movements. How can this be controlled?
I'm not sure how to answer that because I don't know what part of nutrition, like I would assume that if you eat crappy, you move worse. So how can that be controlled? Stop eating crappy. I'm
wondering if they meant movements like bowel movements.
Oh, okay. Oh. Yeah. So same thing. You eat crappy, you poop crappy, crappy. Right. However, for many people, if they go from a standard American diet to a nutrient dense, high fiber, high vegetable, healthier diet, they have some bloating, some gas, and some constipation. So the answer to that is to ease into it, take magnesium, make sure you're drinking lots of water. And if you're still having problems, you might talk to your primary care provider about whether or not you have a little bit of irritable bowel syndrome and what foods you could avoid. It's kind of trial and error.
Okay. All right. Long question, long statement with a question. Diagnosed in November of 20, I've gained 25 plus pounds since the beginning of 2020. All of 2020, I ate very regulated foods, repeated same small meals. Doctors say menopause could be, but I don't think so. It's not that simple. I question if hypothalamus damage could be the bigger problem.
I'm not sure that there's a great way to know that. Your hypothalamus is responsible for a lot of autonomic functions, as is your pituitary neurohormones. They are associated with menopause, your satiety hormone, your hunger hormone, your metabolic rate. Sometimes, depending on how active you are, sometimes people don't eat enough, and so their metabolic rate slows down and they end up gaining weight or staying the same weight, even though they're only eating, say, 1,000 or 1,200 calories a day. There are other medical conditions that can cause weight gain. Certainly, it can be associated with menopause, but it can also be associated with thyroid disease. And with some medications that you may be taking for your MS for symptom management. So I would, I would take a look at your medication list and see if anything could be a potential offending factor, and see about getting your thyroid checked.
Okay, great. All right, I just want to let everybody know, if you're waiting for Paul Pellin to come online, he'll be on in less than 10 minutes. Not yet, Paul. In less than 10 minutes, I said. Okay. All right, now he'll be texting me, what time is that again, or something like that. Okay. All right, so the next one has to do with, does going to the gym increase your risk of COVID?
I mean, I think going anywhere where there are lots of people increases your risk of COVID. So if you're going to go to the gym, which I think is important, and people are going back to doing things, make sure that you wipe down the equipment before and after you use it. Wear a mask. And if you're really concerned, wear eye protection, wear glasses. You do the best you can do, and then you just make a decision about whether or not the benefit you get from going to the gym outweighs the risk of potentially getting COVID. And for many people, the benefit does outweigh the risk. It's a personal decision.
Me too.
Yeah, me too.
Right.
At this point.
Okay. Next, the person is asking about stress relief. What do you favor for stress relief?
Well, I would say watch the presentation again. Take a look at all of the modalities that I mentioned. And if you have not tried any of them, then, have some fun. And one day each week for the next couple of weeks, pick one to try, and then use the one that resonates the most with you. Like, you might like taking 10 deep breaths a day. You might like following Monday Mantras with Megan. You might like using a meditation app. You might like sitting outside and listening to the birds for 5 minutes a day and saying your prayers. So there are so many different things for stress management. And if you're struggling with how to manage your stress, then I highly recommend mental health therapy.
Okay, great. And last thing, the last question. Which vaccine do you recommend?
Whichever one you can get.
Actually, the National MS Society came out today. They have an update that's now on their website that it's recommended that people get Pfizer or Moderna over the J&J vaccine.
Over the J, yeah, I would recommend that for sure. And I would say that since the concerns came out about the J&J vaccine and blood clots more than the others,
right?
And also efficacy. So if you're going to put your body forth to have an immune response to a vaccination, I would make it worth its while.
That's true. That's true.
Yeah.
All right. So I lied about one more question because now somebody just wrote in a question, right? Always has to happen that way, right? I've used the Sankey products and it has helped with pain. Should I use it every day?
I have no idea what that is.
Sanki.
I don't know what it is.
Okay, well, that squashes that question. Again, we want to say thank you to Megan. Megan, that was an excellent conversation that you gave.
Guys.
And I'm glad that you were around to do this, okay?
Thanks, Stuart. Be well.